Hi everyone, I'm Dr. Gabriel Siquier, and for me it's a pleasure to be here in this webinar of today. We're going to talk about Live, Glow, and Repeat, and we're going to have some new protocols together with Dr. Timur Taskesen, and we're going to see cumulative skin quality results. Here you have our disclosures and disclaimers, and I want to ask you, please, if you have any question during the webinar, we will have time at the end of it to be answered on the question and answer section. Don't put it on the chat because we can miss some of your requests, so please put it specifically on questions and answers, and we will have time to answer at the end of this talk. And if there is something that is a little bit more complex, we will take the time to answer you properly afterwards. So don't worry, all your needs will be clarified during today or otherwise after. It has two parts, this webinar. The first part, I'm going to talk about Cellbooster Glow and Lift, and we're going to target some challenging areas like the periorbital and the perioral, but also the décolleté, prosternal area. That is, there are some of the areas that they have more sun damage and that create more impact, emotional impact with our patients. And afterwards, Dr. Timur Taskesen will show us Lift and Glow signature protocol. It's a combination of both. And afterwards, at the end, we're going to have some questions and answers. For the one who don't know me, I'm a board-certified aesthetic physician in the Netherlands and in Spain. It's qualification that the medical college is giving when you have complete certain education. I'm the founder and medical director of Dermatoclinics in International. We have clinics in the Netherlands and Spain. I'm working for Swissell for more than 10 years worldwide, and at university level, I'm part of the research group NIOMA in the University of Girona in Spain, where we developed some of the protocols and we published the scientific articles about the Cellbooster products. And now I'm going to give the word to my colleague, Dr. Timur Taskesen, so he can introduce himself.
Thank you very much, Dr. Siquier. Thank you, Gabriel. Hello, everyone. For those who don't know me, my name is Dr. Timur Taskesen. I'm a dermatologist and medical director at Derma Aesthetic in Zurich. This is my own practice, and my training included biology and medicine. And then I did my residency in Germany, and now I'm here in Switzerland. And in my daily practice, it's just like I strongly focus on regenerative and skin quality oriented treatment concepts. And so I'm really happy today to share this webinar with my dear friend because we can just like share how we approach, for example, with Cellbooster Lift and Cellbooster Glow as a kind of structured protocol for nice facial rejuvenation. So I'm giving the word back to Gabriel, and I'm looking forward to a great webinar. Thank you.
Thank you very much, Timur. And let's gonna see the injections of glow and lift in these specific challenging areas. The periorbital area, generally we're gonna have thin skin, we have risk of edema, and we have vascular sensitivity. The perioral area, we're gonna have dynamic wrinkles. It's an area of high mobility, and we also gonna have a good product diffusion. And the prosternal area, the décolleté, we also going to have dynamic wrinkles, but it's one area that the patients normally, as the neck, they forget sometimes to take a good care, to put some protection, and we're going to start to have some static wrinkles, so like logo type 3 static wrinkles, not wrinkles, only movement, and we can take the benefits of Cell Booster Lift to regenerate this area, to do this indirect lifting to promote a better structure and better aesthetic results. If you are looking to the contributors to skin aging, the most important is the sun radiation, the pollution as well, but also the lifestyle. If you are smoking, if you're not having a good diet, if you don't sleep properly, you generate some stress. And this stress will stimulate the reactive oxygen species, the ROS, that will create sort of inflammation on the area. I like to call it inflammation because this is going to affect the extracellular matrix, and this inflammation can make hyperactive the melanocytes, increasing the melanin content. So we are going to have not only a destructuration of the extracellular matrix, but also an increase of the pigmentation. So it's important to target the two things to give the building blocks to fibroblasts and keratinocytes to produce a better and a healthier extracellular matrix that will imply a better quality of the tissue, but also to reduce this inflammation, to try to control this hyperactivity of the melanocytes to reduce the melanin content. When we are talking specifically about the periocular aging, we know that we're having bone resorption in the frontal bone, and that will create a brow ptosis. And we also are having hollowing that will enhance the glabellar furrows and lower dermatoclasis. We're going to have also, because of bone resorption, we're going to have ptosis of the fat pads that will create a prominent nasolabial folds, and we're going to start to lose some definition on the jawline. Different areas, they age at different timings, and it's important that we understand from an anatomical point of view that the area that is going to age the first is going to be the periocular area. So sometimes we leave it like for the last thing to do. We are more focused in a little wrinkle on a different place, but the periocular is going to be one of the first is going to start to age. So it's important to have a good quality skin, to have a good sun protection there, and to have the right timing and protocol to achieve a better aesthetic result. One of the most important worries is the periorbital hyperpigmentation. We can see it with aging, and sometimes it's not hyperpigmentation because it's a complex area, the periocular, and sometimes we call it like panda symptom. This is from a publication I did backwards some years ago, that we is characterized by darkness of the eyelids, the upper and the lower, and this condition affects individual of all ages. Doesn't matter if they have 20 or if they have 40 or 50 years old. Generally, it's genetic. It doesn't matter the sex, if they are male or woman, and it's more frequent in the Middle Eastern morphotype. So we have some specific ethnicities that they appear more with this panda symptom. If you are looking specifically of the different types of periorbital hyperpigmentation, we can find this constitutional hyperpigmentation. The patient show a curved band of brownish to dark skin pigmentation on lower eyelids, approximately the shape of the orbital rim, with the involvement of the upper eyelids, as I told you before. We can have post-inflammatory hyperpigmentation. This is done through hyperactivity of the melanocyte, and can be again upper or lower, but also surrounding areas. This post-inflammatory hyperpigmentation sometimes is also related to melasma type, so we can have it not only on the eyelids, but in other parts of the face with this butterfly morphotype. We can have it vascular. The vascular is more a bluish discoloration. It's a bluish discoloration because of the thin skin that we have on this specific area. That allows the little vessels to be seen. So it's like transparent. You can have a shadow effect. This is mainly due to structural anatomical factors like overhanging of the tarsal muscle, eye bags, or a deep tear throw. And we can have others as internal disorders like anemia, hormonal disturbance, nutritional deficiencies, skin disease, acanthosis nigricans, nevus, and some drugs like latanoprost or bimatoprost eye drops that they can give this specific hyperpigmentation on the area. Most of the times will be combined with puffiness. They will come with puffiness and dark circles and can be mistaken by tiredness and premature aging. So the patient is telling you, everybody's telling me that I feel tired, I start to look old, but it's not the way I look, is not how I feel. So for them, it's very important, not only from an aesthetic point of view, also from a psychological point of view, because as I told you, it's very complex. We can have hyperactivity of the muscles that will generate brow fits. We can have dystosis from the brow. We can have excess of skin of the upper eyelid. So we need to target specifically all the issues from this periocular frame in order to answer properly and in order to combine effectively for the best aesthetic result. If we are looking at the treatment areas, we're going to have the tear throw. If we have volume loss or depletion, I recommend to treat it with hyaluronic acid filler. We have the Apriline line with very good integration and cohesivity. On the palpebral groove, we have to be careful in patients that could have edema, so to put a lot of product in that area. And the upper eyelid must also be treated. Sometimes we forget about it, or the area between the brow and the upper eyelid also can benefit from this treatment with Cellbooster. Overcorrection is the most common complication in this area because sometimes we're thinking that this hyperpigmentation will be solved with a hyaluronic acid filler. So we need to make a clear distinction. Where we have the volume loss, then we're going to need the hyaluronic acid filler, or when we have hyperpigmentation, and then we're going to use Cellbooster Glow to treat this area. What is important for Cellbooster Glow is that we have very specific ingredients. We have vitamin C, vitamin B7, glutathione, and cysteine. The vitamin C is an inhibitor of the tyrosinase. The tyrosinase is an enzyme. We need to transform the tyrosine into melanin. So if we do an inhibition of this tyrosine, will have a reduction of the final melanin. The same, vitamin C is also antioxidant, so we can do a double inhibition of this tyrosinase, and the glutathione also is an inhibitor of the tyrosinase. So we are having two ways to attack this hyperproduction of the melanin. And don't worry, you're not going to have hypopigmentation because we are going to work in a physiological pathway. We are not going to create inflammation. It's going to be the other way around. We're going to reduce the skin inflammation. We're going to protect the skin against free radicals thanks to the antioxidant effect and thanks to the hyaluronic acid matrix that we have into this formulation with 80 milligrams per vial. We're going to give a better hydration and we're going to improve the cellular ambience. So it's going to be like a better carrier for the active ingredients to target the specific cells to reduce the pigmentation on the area. Let's gonna see, in this case, is a young lady, is 23 years old, and she's worried about the hyperpigmentation that starts to appear on the upper eyelid and the lower eyelid, but also lateral canthus. We can see that she doesn't have any wrinkle at this moment. Is a young patient, but starts to worry because generally it's a genetic thing. So she's seeing the mother, the way is progressing, and is worried about that. We did 3 sessions bi-weekly with 3 milliliters per session. We put a maximum of around 1 milliliter per periocular frame, and the rest we divided around the area, and we can see a tone unification. This is 2 weeks already, 2 weeks after the third session, and we can see the even tone resolution that we have after this protocol of 3 sessions bi-weekly. That is what is recommended for this treatment. This patient, from my point of view, it's a genetical thing. So if we stop doing this treatment, she can get back to this hyperpigmentation. We give her proper indications about how to use the sun protection or how to protect the eyes, for example, with sunglasses in days of higher radiation. And in this specific patient, I see very good results. So I will recommend 1 session follow-up treatment every 2 months just to maintain the result, to give this reduction of the production of melanin, and then again with the sun protection, both combination, always very important when we are treating hyperpigmentation. Here we see different case. This patient is 50, and besides the hyperpigmentation, we can see already that we're having a little bit of brow ptosis, we're having excess of a skin on the upper eyelid, but we also see that the quality of the skin is much worse. We could use Cellbooster Lift, but my target and the desire of the patient was the hyperpigmentation of the area. This is why I selected Cellbooster Glow. Here we can see a massive improvement of the skin quality. Remember that Cellbooster Glow has a very good cocktail, and besides has the hyaluronic acid to improve the quality of the skin. And we did 3 sessions bi-weekly, 3 milliliter per session, the same, around 1 milliliter periocular, counting the upper eyelid, and then the rest of the product is this marvelous cocktail I injected in other areas of the face to complete the treatment session. But we can see here a very nice result. You can see here a little bit the darkness. This patient has a tattoo, makeup tattoo, so that's why we couldn't remove it during the session, but the quality of the skin and the reduction on the hyperpigmentation is very much evident with only 3 sessions. Again, I will recommend her to continue with sessions monthly or bi-monthly, but in this case, the patient is a little bit older. I will maybe overlap 1 time with Cellbooster Glow, 1 time with Cellbooster Lift to achieve a better aesthetic result. Let's gonna see the technique is very simple. You have very, very thin skin here. So remember that the best is to inject intradermally. And I use the papula technique. You don't need an aesthetic. I'm using an invisible needle, very thin needle. But if the patient is very sensitive, you could apply a little bit of topical anesthetic in the area. Generally, you're not going to generate a bruise at this level, but if it happens, well, it's all is in the game. I recommend some arnica cream afterwards to help this little bruise to disappear faster. Besides that, we don't expect to have any huge edema on the area because the hyaluronic acid is native, is not cross-linked, is stabilized. It's stabilized thanks to the CHAC technology, but it's not cross-linked, so will not last there very much, but will last enough to change the structure, the hydration on the area. Here I want to show you also on the upper eyelid how I proceed. The same technique, some little papulas covering the area. I know the product will diffuse very good because it's an area of movement, and I don't take any specific care to that. Sometimes a little bit of an aesthetic cream. Patients that they are very, very sensitive, you could mix a little bit of lidocaine or chalocaine, generally 1 milliliter of 20 milligrams per milliliter of of anesthetic in the vial. And for patients that they are very sensitive, but generally it's painless and very good to go to your daily activities afterwards. Now, another frame that also is worrying us a lot is the perioral frame. We can have different morphotypes. The first one, when we're going to have to start intradermal wrinkles, morphotype 1, when we're going to find the volumized lips. The morphotype 2, we're going to have central lips, and morphotype 3, we're going to have shaped lips. Morphotype 3 generally is much more aging on the area. Remember that some of these lines, barcode lines, they're going to be deeper than we expect, and we should use a filler or a biorevitalizant, for example, Apriline Hydro for the barcode line, and then we could use Apriline Normal to rejuvenate the lip. But what I wanted to talk today is about perioral hyperpigmentation, because also with Cellbooster Glow, we can inject on this sometimes hyperpigmentation. It can be again coming from melasma, but sometimes also coming from what's depilation on the area that can create a little bit of inflammation and can generate some hyperpigmentation on this upper lip. So the same injection is going to be intradermal, is a little bit more sensitive this area. You can do a little block if the patient is very sensitive. Otherwise, with some topical anesthetic with EMLA cream or any anesthetic cream that you can prescribe for the at the pharmacy, the treatment is very simple. I'm using the papula. Remember to inject on the deep dermis or intradermal, because there's where we're going to target the melanocytes, and not a lot of product per point. 0.05 milliliters per point, I think, is the ideal. And then the product will diffuse by itself. Here we can see on the upper lip that we have some marks, brown, and then after the treatment has been improved efficiently. So patient is very happy. She didn't want to change the lip. She didn't want a lip treatment, but wanted to have a better structure. We are on the morphotype 1 or 2 in this case. So it's a good indication. We can combine it as well with fillers, because we're going to inject fillers deeper. We're injecting on different planes. And if you wish to put a little drop of botulinum toxin to relax a little bit the area, always remember little quantities, 4 or 5 units on the border of the lip can relax a little bit, so the aesthetic result will be even better. Combination will always enhance the results, and Cellbooster is giving a plus to all the aesthetic treatments that we can perform. Now, if we're talking about Cellbooster Lift, we having a much higher active ingredients. In this case, we don't have the glutathione, but we have the vitamin C, E, B2, B7, and amino acids. And we're going to hydrate the epidermis and regenerate the extracellular matrix. We're going to stimulate cellular functions, and we're going to activate the collagen and elastin production. So it's meant for a demographic that is a little bit older from my point of view, so the patient has much more needs for that treatment. The area where I like to use the most is the neck, but the décolleté. The décolleté, we always forget about it, and we also forget to put some protection on this area. And here we can see already some intradermal on this specific triangle that we have in between the clavicles and in the middle of the breast. This triangle, that is the one that is most affected by sun damage, by photoaging. The technique is very simple. You can do the papula technique, again covering the area, little amounts per point. Intradermally, we want to target that area intradermally, because we want to regenerate from the epidermis till the hypodermis, keratinocytes on the epidermis, fibroblasts on the dermis, but also to reactivate the quality of the tissue from the hypodermis to go from an empty dermis to a full dermis, thanks to the activation of the extracellular matrix without any kind of inflammation, because we don't have any cross-linking product, we don't have any stabilizing product on the CHAC technology. We don't have any of that on Cellbooster. It's pure hyaluronic acid stabilized mechanically thanks to the process of shear deformation and pressure that has been developed and patented by Swisscell. Here you can see the technique. It's very simple. If you are on the proper plane, you're not going to have risk of big hematomas. And again, as usual, you can put a little bit of topical anesthetic if the patient is very sensitive, or you can mix a little bit the product with some chilocaine or lidocaine. Some other techniques, sometimes linear retrograde. I'm doing the other side of the décolleté. And the quantity of the product, I generally use my hand as a measurement tool. So for example, a hand can cover the décolleté, so that's one vial of 3 milliliter. A hand can cover the neck, so that's another vial of 3 milliliter. But imagine that you want to target other areas of the body, like the belly or the arms, the legs. You should use generally one vial per arm, per leg, or per side of the belly, because result is also dose dependent. We need to put enough product to achieve the desired results. Here we can see the before and after. The light is a little bit different. We are in my practice is in Mallorca in Spain, so sometimes to control the light that is coming from the outside is a little bit more complicated. But you can see on the center of the décolleté the quality of skin, how much has improved, and the reduction of these little wrinkles that start to worry to our patient. Here's another case. Also, we can see here with better view these lines that they are in the middle of the décolleté, in between the breast area, that has relaxed very much and also has reduced a little bit the hyperpigmentation. Why not to know that? Because we don't have glutathione, but we do have vitamin C in the cocktail of Cellbooster Lift. And after all this talk, I think now it's time to change the speaker. So I'm gonna give the word to Dr. Timur Taskesen. Allow us a few minutes, a few seconds to change the sharing screen. Timur, the floor is yours. And you are on silent, Timur.
Thank you very much, Gabriel.
Now we can hear you. Thank you.
Now, perfect. So let me just quickly check. Can you see my presentation?
Yes, we can. Thank you.
Good, perfect. So thank you. I'm looking forward to present as well as you, but it's going to be tough. So second part would be just like, I want to show you how I use Cellbooster Lift as a part of this signature facial rejuvenation protocol. So for me, Lift, as Dr. Siquier already said, works for me in the deep dermis, and this is where I want to support the axillary cellular matrix quality and also the collagen-related regeneration and overall the tissue density. So in the same session, usually I also combine it then with Cellbooster Glow more superficially, close to the dermo-epidermal junction, so a little bit more superficial, to address more the radiance and the hydration and also the surface refinement. So as Dr. Siquier already showed in his previous presentation, it is something that is really having a nice result. So this is not simply combining two products. It's more just like a kind of vertical treatment strategy across different kind of biological planes. Oh. So when we talk about facial aging, and this is also what Dr. Siquier already said, it's just like it's not only about the wrinkles. So aging is just like a multifactorial problem, but aging is also a problem of the matrix failure. So when the dermis loses its kind of organization, the hydration behavior and the resilience are changing. And so we lose this kind of fresh, rested quality. So when we are aging, it is also just like changing a lot. And so this is also why I see Cellbooster Lift not as a volumizer, but more just like a kind of regenerative supportive layer. And the goal is here just like to have better tissue quality and more density, more viscoelasticity, and just like a natural kind of pseudo lifting effect without the volumization that we get when we usually go for cross-linked hyaluronic acid fillers. So for me, I like to explain Cellbooster Lift just like in three parts. So first part is the scaffolds. The second is more the signaling, and the third is the clinical expression. So first, the stabilized hyaluronic acid with this special shock technology that has been developed by Swisscell is supporting the hydration dynamics and creates a more kind of favorable environment. So like the water that is needed for the plants to grow, and also just like to nourish the plants, we have the second, the amino acids, the antioxidant vitamin support. So it's just like giving the flowers just like the support to bloom and to produce really good quality blooming. And this is in our skin's nature, the fibroblast related activity that we are just like supporting. So we have just like also a collagen support. And third is the what we see clinically, and this is also what we saw in the pictures that Dr. Siquier provided already, is just like the improved hydration. So the skin feels or seems even just like better. It feels more dense. It looks fresh. It looks tight. And this is what we all want. And that look becomes more visible when we repeat it over more sessions. And so this is also very important to get you there. And this is also what I'm going to show you now with my next slide. So here I'm introducing the first patient example. So here you can see on the left the before, and on the right the after. And what I want to focus is not only on the lines, it's just like the overall tissue behavior. So the degree of dullness that we have, and also just like the dermal fatigue. So she looks a little bit tired. She even seems to look a little bit sad on the picture, and also the loss of freshness that is quite evident. And this is the kind of patient where I feel like this kind of matrix first strategy can be just like really useful to strengthen the skin. And in the next slide, you can see the quality changes that just like matter for our patient, because it's about the hydration, it's about the texture, it's about the light reflection, and how tired the skin looks at rest. And after just like three sessions bi-weekly, you can see that the skin seems to improve, and they improve with the first parameter that the people are just like feeling is that they feel like the skin seems more dense. And so this is where we also see a kind of healthier surrounding for our skin. And for me, it is to rebuild from deep to more superficial levels. And so this is why I also inject then the Cellbooster Lift, usually with papulas, deep dermal, and then superficially going in with another kind of angle with a Cellbooster Glow. So lift is used where I want the dermal support and the density, so usually in the lateral parts of the face, but also just like going on around the zygomatic arc. You can also support it here in the neck area and on the jawline area, but also just like everywhere you feel like the skin needs support. Usually it's easy to see when you pinch the skin, you will see a kind of laxity that is forming, and these would be the areas of concern where you just like place the product. So this makes the results later also look more biologic and more progressive than are rather artificial, because usually we don't want to overfill our patients. But with the non-cross-linked hyaluronic acid complex, it is just like not an issue. So I feel like this is also helping because we're not just like chasing something, we're just like trying to improve the behavior of the skin as an organ. And this is why I feel like these protocols of using two in one, and also just like as Dr. Siquier already said, combination is usually key. So if you combine it also with different kind of other superficial strategies, it's always good. But this is the good kind of combination. If you just like can combine two products out of one product line in one treatment session, and then you will have just like a really more rested and more natural result. But as already been said, it's also possible to combine with other products as well. So this is just like a kind of overview to see how the improvement of the skin is changing, and also that you feel like the improvement coming from deep and going upwards. So it's just like you can see the face already appear fresher, firmer, and more harmonious. And this is, I feel like, the best kind of treatment that you can give our patients if they do not want to look different. And so this is also pretty easy that we kind of feel like, okay, this is a strategy which is easy to follow and which is super safe as well. So the concept behind the protocol of combining Cellbooster Lift and Cellbooster Glow is something that I feel like Lift for the deeper dermal support and Glow more superficially, where you have just like the luminosity, the surface fatigue, and it shows first very superficial. So you can also start with Cellbooster Glow, and then maybe a week or two later, you can do the Cellbooster Lift. If you want to do it in one session, it's beneficial for the patient, but you can also do it just like in different sessions. And this is just like an idea to have just like a nicer kind of logic behind, and where you put the product is also very important. So Lift Deep gives the ECM support. It will also have a signaling support for the collagen buildup and for the skin density. So this is what the people just feel. Glow gives me more just like brightness. So this kind of hydration and the surface freshness that they get. And this is, so the idea is just like to treat vertically to have a really nice result. And this is something that is also helping, not just like by stacking the products, but just like to think about the rationale why we do, for example, things that we do. Male patients are usually also just like a little bit more pleasing because usually male patients do not care much about the skin. And so I want to show you just like this nice patient example, and please look beyond these single lines, and you can see there is a lot of the things that we can improve. So for example, here, the double chin area, also just like maybe the reduction of the facial signs. So it's just like something where I want to guide your focus more on the skin quality, on the texture, on the brightness, and just like the vitality. And here with male patients, these kind of same session vertical layering can be especially rewarding. And this is something that we can see with this patient as well. So up close, we can see the reduction of the sebum. We can also see the reduction of the inflammation overall, especially around the nose and the chin area. You can see that the skin seems lighter, that the superficial kind of radiance is just like definitely better. And we also have just like a conditioning, because this is what we already said before, because these products are kind of helping to reduce an inflammation in our skin. And so inflammaging is real, and inflammation in itself is also causing just like the breakout of chronic skin issues. And so the combination of two things that help to reduce the aging process in a different kind of way. First, glow, superficial radiance, lift, deeper dermal conditioning. And so by this, we have just like a nice option to reduce that. And here it was more just like this kind of enhancing the skin. And so this is something which is really helping to create a nice result without looking different. And here you can see the improvement of the skin and also just like the reduction of the redness. And it's just like it looks more rested. And he looks more rested. And this is also, he doesn't look treated or done, which is most of the times the things that male patients want because they do not want to be judged by anyone. And even though it is just like a great time now to do different kind of things and also just like for male patients, but nevertheless, most of them are just like too afraid to do too much. And as I said before, the idea is also by repetition to have a maintenance, to have a kind of that we can keep this kind of refreshing result that we have. So this protocol is designed to accumulate. So what does this mean? So it means that we have just like 3 treatments at intervals of around 2 to 3 weeks, followed by monthly maintenance. And why is it so important to repeat? Because lift keeps just like reinforcing the regenerative message, while glow keeps refreshing the superficial interface. So this is what makes the outcome cumulative rather than just like maybe cosmetic or temporary looking. So because this is something that is also helping to support the skin's needs by also being able to reduce the inflammation inside of the skin. Here, for example, glow's ability also to reduce the pigmentation and hyperpigmentation. Here you can see it definitely on the forehead, but also just like on the dorsum of the nose, and also just like a little bit perioral, all these areas that Dr. Siquier already talked about, and these are tough to treat. So here we have just like also not only the pigmentation issue that makes her look different, but also the global impression just like of this fatigue. And so this is very important in regenerative aesthetics to have a pleasing result for our patient. And you can see also here the reduction of the pigmentation, but also just like the reduction of the fine lines on the forehead area, and the skin looks more bright. It looks more rested. And this creates a kind of harmony. And so she looks definitely a lot better. And you can see also after 3 sessions of using the products here in combination, we have a reduction overall. We have a healthier skin, and we have reduction of pigmentation as well. So this is something where I feel like it's matrix support, but it's also just like about visible radiance. And this is something where we see that the face does not look done at all, no? But you can see definitely the improving skin. And this will be just like an ongoing treatment for her because she's suffering a lot, and she has been just like suffering a lot of the melasma as well. But now we found a good kind of combination for her to reduce these kind of signs, and also just like by counteracting a little bit against this aging process. In total. And you can see also around the eyes that the eye area is also improving. And this is something that is really nice to see. So we have just like a better version of their own skin. And this is something that many people just like also like a lot. So this final case is just like brings us back, and this is also just like the final slide of my presentation, brings us back to the key idea of this webinar, because to combine deeper dermal conditioning with superficial radiance support is just like to combine lift and glow, so we can create more natural looking results, more kind of layered, repeatable, safe protocols. So this is also just like easy and also just like practical in your everyday practice. Oh, that was a little bit too quick. Yes, so you can see it also just like from the sides. So this kind of better reflection that we get just after even only 3 treatments. So my take-home message for you would be just like very simple. So, oh, These is just like, sorry, we add this because this is a protocol we just like Dr. Siquier and me just like developed a few years back, and this is something that is also just like perfectly fitting in this area because as Dr. Siquier already said, there are different kind of morphotypes around the perioral aging, and this is something where we can just address that also just like very good in combination. So this is a combinative treatment protocol that we just like did for the periorbital frame using erbium YAG laser in combination with a cell booster glow. So reducing pigmentation, building up the superficial layers of the skin, but also having just like a very good step for the reduction of the pigmentation issues. And by using an erbium YAG laser is just like an ablative laser to reduce just like the signs of aging, but also just having a fractional therapy for the superficial layers of the skin. And then the next step would be just like after waiting a short amount of time to inject then slowly in the selected area. So in this case, perioral, but this can also just like be periorbital. Same idea, no? But here we go with a cell booster glow a little bit deeper because we have just like this combined idea of the cell talk, of the crosstalk that we have, no? And so this kind of combination complements by having just like really nice effects for the not only for the radiance, but also for the hydration, for the luminosity, but also just like for the refinement deep down. No? So, and this is just like a really good kind of ending now, no? So that we can have nicer, better looking skin. But we do not only just like have a nicer skin, but we helping it to behave younger by supporting this kind of structure around our fibroblasts, around all of our cells. And this is something that we just like also can see after just like a few sessions. And this is also helping us to achieve also better looking results for our patients. So I'm looking forward to your questions, and I hope there are some. And thank you very much for your attention. And I hope this gives you just like a practical way about Lift and Glow, not just like isolated injection products, but also maybe just like kind of a protocol where we can layer this. And I'm very happy to share this webinar with you, Gabriel, and I'm happy to discuss your questions out there. So please send them in the Q&A session, and then we can just like answer them back to back. So thank you very much.
Thank you, Timur, for this great explanation and great results with your cases. And we have a question for you from Jelena Petkovic that is asking, can I combine with FRATS 1550?
You can. It just like it's always important just like to know that what you are just like addressing, and also just if you go for deeper lines, you can do that, you know, but you can also just like combine it with a lot of different kind of energy-based devices. Yes.
Well, and another question for you, and it is asking, what is the difference about Cell Booster and Hyaluron? I know Cell Booster help me more for skin, only I won't know you think this Cell Booster is very better to face a more long time. From Aneta Moons.
What is the big difference between cell? So depending on what kind of question she's referring, because Cellbooster also contains hyaluronic acid. So, but this one is just like not cross-linked. So in the end,
Yeah, well, I think the big difference between Cell Booster and native Hyaluron is that Cell Booster is stabilized,
yeah.
so it's going to stay for at least 2 weeks in the tissue, and that will help to have a better cell activation. So that's the big difference between Cell Booster and any other cocktail that you have in the market. And
Yes.
it's not only stabilized, it's a class 3 medical device. So that means that can be tested, is safe, and is effective. So you have the security that you're using the properly right product to give the best results to your patients. Okay, and then maybe this one I can answer. Say how long it will last, Cell Booster Glow in periocular area. after the third session? Well, it depends on the kind of patient that we have before. So if we have a patient with melasma, it was something induced by some medication, something metabolic, or not. Generally, I would recommend monthly or bi-monthly session to maintain the results. But we have studies that, for example, with Cellbooster Lift, after 82 days, we still see an improvement on the quality of the skin. So it lasts longer, but it's like going to the gym. The moment you stop training, you're gonna lose muscle mass, but if you continue training, you're gonna maintain. So it depends a little bit of the expectations and needs from your patient. And we have one bit for you and for me.
Mm-hmm.
Timur say, I do not understand. It's from Alexandra Mureseanu. Dr. Gabriel say that for leaf we can do papula as well, but Dr. Timur say that the leaf has to go deeper. Okay, so I'm gonna give my answer, then you give yours.
Yes.
Say, well, you can do papula, but the meaning is to inject deep dermally, so intradermally, but on the deep dermis, cell booster lift, because we want to target different kind of obstruction. You know, we want to target more fibroblast and hypodermis. And what's your answer?
So it's just like for me, I always say that there's no right or wrong because the products are designed not to do any harm in whatever kind of layer you put them. So even if you would put them in the hypodermis, so in the subcutaneous fat tissue, you would maybe have a loss of the product, but you still have this crosstalk that you have between the cells, and so you will have a result. But cell booster lift is just like designed to be injected in the deep dermis because it just like supports the fibroblasts, it supports the ECM, and so it just like it's a kind of build up for the ECM matrix. And so you can put it superficially, but best would be just like intradermal papulas, and then this is also the idea behind the stacking that I showed. So deeper, more superficial.
And then a question from Sarmat Ibrahim, can any of the boosters be used supraorbital? Let's say all of them can be used supraorbital. All of them, they have the CE mark to be injectables, and then you need to target the need of the patient if you want lift or you want glow or you want shape, for example, to reduce edema. You could also use shape on that area. So it's not contraindication for the area. We need to target very good which one is the indication from our patients. And another one for you. Say when you combine lift plus glow in the same session, Dr. Timur, you use one vial deep and one vial superficial, not hybrid-like combination, right?
No, it's just like this is right because you, as Dr. Gabriel also said, about one palm, so it's just like one vial, and then you just like place one deeper, one vial, 3 cc, and then the other one just like on top of that. Yes.
And yeah, well, the depth, I think, is the questions of today. So when Dr. Timur says deep, we are talking 4 millimeter.
So here, 4 millimeter would be already too deep. Here, 4 millimeter can be okay. So it depends a little bit, but you will notice when you are intradermally and you are deep dermal, you need a little bit of more pressure to bring the product out. No? And it will be even higher when you just like when you are very, very, very superficial. No? Depending also just like on the tip of the needle. No? But it depends on where you are. So it can
Yeah,
be
well,
four, it can be
we know we
three.
have different thickness. So, for example, peri on the lower eyelid, the
Yeah.
skin is very thin. On the body, the skin is a little bit thicker.
Yeah.
So, the important is the plane of injection, not the depth. So, when you want to target deep dermis, for example, in the body, you can go a little bit deeper with a longer depth, but when you want to
Mhm.
target other areas. So it's important that we know what we want to target while we are injecting. And another question from Jelena Pekovic, say glow is for melasma on forehead? Yes, glow is for melasma on forehead, on periocular, everywhere we have hyperpigmentation, post-inflammatory hyperpigmentation, we can inject cell booster glow and it will work. And you are the boss of the lasers and energy-based devices. You say IPL first and 21 days secondary use glow for melasma.
So I would maybe do it the other way around. So I would use Cellbooster Glow already to reduce the activity, to bring just like skin homeostasis, to calm down the inflammation, and then you can do the IPL maybe a week even later. So this is possible, and you can just like do IPL Glow, IPL Glow. This is possible.
But I generally recommend to do it on the same session because you save
Yes.
uh, traveling for the patient. If you wait these 15, 20 minutes, as we saw on the previous
Yep.
slide that Dr. Taskesen provided from the protocol we designed together, it's enough. You can do it on the same session. Okay, and I see one from Pablo Javier Perez. Say, hello, can we use IPL, Fuiste, and 2 second session low for Malaysia? I don't understand very good this question. It probably is the same. If we can use
Mm.
IPL and a second session with glow, we can do it on the same session, but always the energy-based device first.
Yes, and the question, for example, from Selinidin is also just like it's proposed in Turkish, and this is also they asking if it's possible to do the erbium laser at the same day of the usage of the Cell Booster Lift or the Cell Booster Glow. And so yes, it is possible. No? And as Dr. Siquier already said, just like start with the laser first, and then wait, and then you can inject the Cell Booster. Do not heat the Cell Booster. So first the laser, then the Cell Booster.
How many treatments are needed for melasma? So, well, we start always with the basic protocol, 3 sessions biweekly, and depending on the type of melasma and, for example, on the site topical treatment that the patient is doing, we know that we can combine now with tranexamic acid and good sun protection, for example.
Mhm.
Then you need to adapt the protocol to your patient, but always start with 3 and then monthly or bi-monthly do a follow-up treatment to maintain the results. Melasma is time, sun protection, and cell booster glow combination from my point of view.
Yeah, I couldn't agree more. Yes.
Okay, the rest are in Turkish, I guess, so you
Yes,
have to help
the
me.
Confulia, it's just like if a combination is possible with PRP, so you can, it's possible, but again, just like think about what you want to achieve. So what's the idea? What's the rationale behind using the PRP? What's the idea behind using, for example, Cell Booster Lift? Or what's the idea of combining it maybe with Cell Booster Glow? And then you can just like if you inject them in a different plane, then it's possible to combine it in one session, yes. But I would not inject in the same plane at the same time with PRP.
Yeah, that's very important. Don't inject different products on the same plane. So, for example, when we are trying to explain you this combination, cell booster glow on a more superficial plane, cell booster lift on a deeper plane, because we don't want to have a cross reaction on or any kind of problematic with this
Mm.
product.
Yeah. The next is also just like in Turkish from Vildan Demir. It's just like if it is just like also safe to be injected on the dorsum of the nose. No? So yes, it's possible, no, but stay very superficial. No? So it usually pains a little bit more by the patients, but this is just like possible. And these are non-crossing hyaluronic acid products, so the likelihood to cause any kind of vascular problems is very low. But nevertheless, it is a kind of dangerous area. So be aware, and then also just like inject little amounts. And then you saw it also just like with my patient with the hyperpigmentation on the back of the nose. Inject very superficial, very few amounts, and also just like as Dr. Siquier said, 0.5 per point is more than enough.
Okay. So from Celine Aydin.
Yeah, this is also just like about the erbium laser combination, and you can do it at the same day. So this is again about, for example, for the neck. If you can do erbium laser for the neck and also just like inject cell booster lift that on the same day. Yes, and this is also good for skin laxity. So you have something with a cell booster lift to attack that and also reduce the downtime.
And one from Victoria Dibor, I think is a very interesting question. Can you combine glow with microneedling for hyperpigmentation? Definitely, and it can be done on the same day, but we're having a product that is specifically sterilized and with all the warranties to be injected. So I think it's a little bit a pity to waste the product on top of the skin. It's better to inject it, but definitely you can, and I don't know the regulations in your country. For example, if you are a skin therapist or a beautician or a nurse, sometimes you are not allowed to inject, but you are allowed to do microneedling device. Definitely, you can use it very safe, and you also going to have a good result with all the Cellbooster product line.
Yes.
And two more to go.
Yeah. Selenite is just like asking how many days in between to use the lift. So it's just like our protocol is usually based on the bi-weekly use of the products, but depending also just like on what you are trying to counteract, you can also do more sessions. You are not limited to 3 sessions every second week. Well, it depends. You can, or you just like maybe change the intervals and use maybe cell booster lift and then cell booster glow. But just like the biweekly protocol is more than enough because of the stability of the shuck and also just like of the hyaluronic acid. It is just like also good and also to do it every second week. So you don't need to do it every week.
No, it gives the time because it's probably stabilized, so it's going to be in the tissue. So
Yes.
you give the time to the cells to be reactivated by the active ingredients
Yes.
on the formulation. So, and it's the last one.
Oh, that's the question about the PRP because she asked if it would be just like beneficial to do it in one session. And yeah, sure, as long as you don't inject it in the same plane. It can be beneficial depending on what you are kind of achieving.
Uh, I'm asking if we prefer using cannula or intradermal when for periorbital. Well, it depends on the type of patient. If you have a patient that is that you touch them and they immediately bruise, you could also use um, cannula, but I prefer to use the needle because I want to place cell booster glow intradermally. So I wanted to target specifically this area. And then Aneta Moons, how many days? No gut after injection in exotic love is normal plus 54. But I don't understand very well the question. I imagine that say how many days no sun after injection.
I guess so, yes.
So you can go directly 24, 48 hours after injection, and we recommend a 50 plus sun protection as regular. Mm.
So there's one last question. No? I think this is
This
for you.
Yeah, sorry, I missed the answer. Can it be injected deep into ligaments? BAP technique? Well, the BAP technique is not for cell booster, it's from another protocol brand, and it's not meant to inject deep into the ligaments, it's also to be injected dermally. But the products are different. So I will recommend to use the treatment options we said today. So deep dermally or intradermally with papula technique, or in some cases you can use a cannula if necessary, and to target the different planes. When we are injecting on the deep dermis, big quantities can create a little bit of dissection of or trauma of the tissue, so we don't recommend to use the products in this way. Even though we know that there are no cross-link or anything. So there are different technologies meant to be used in different ways. Don't get confused. When combining microneedling with lower leaf, which should be preferred? This is based on the patient needs exactly. Or do you have a specific priority? No, it's based on the patient needs. If you have more hyperpigmentation, I will use glow. If you want to do better densification, I will use lift. And if you have both, maybe we do combination, one time lift, one time glow, but remember that microneedling is not the best option for these products because the quality is so high you can inject them directly with all the security and all the CE marking.
Yes.
And again, for forehead, which one do you prefer? Again, it depends on the indication of the patient, what you're looking to achieve. So we got quite a lot of questions and we managed to answer all of them. If you pop up another thing or you want to know more about the protocols, please contact your distributor. We will assist them as always, and we hope to see you soon in another webinar with some more cases and new indications for this amazing product line that is Cellbooster from Swisel. Thank you very much. Thank you, Timur. It was a
Thank you,
pleasure
Gabriel. Thank you very much.
as usual, and hope to see you soon around the world. Have a nice day. Bye bye.
Bye. Thank you very much.